Good morning, everybody. This is Val Sada. Today we're just going to briefly talk about the learning outcomes for our Nursing 320 research course. So the first thing to think about is what you're going to learn through this course related to your BSN program. So these are the learning outcomes for our particular BSN program. And you'll notice that there are 4 that we'll be meeting. The first one is synthesizing evidence-based knowledge from liberal education, nursing, and other disciplines to guide your practice. This is important as you think about the importance of pathophysiology, microbiology, biology, and all your nursing courses up to this point will help inform how you're going to do your research. The second one is to engage in inter- and interprofessional communication and collaboration. Again, our focus here in our program is on safety and patient outcomes. So we're going to be talking about and using the evidence-based practice processes that nurses have developed to help meet the needs of our patients. The third one is demonstrate skills in the use of information and healthcare technologies. You will be using the internet, you'll be using databases. All of these are important pieces of skill that you need as a new nurse as you start your practice in the profession. The fifth one is to adhere to a professional, moral, ethical, and legal framework to guide your decision making. So in this course, we will be talking about the ethics of research and how important it is for us to consider the ANA Code of Ethics as we move forward in developing and creating evidence-based practice. At the junior level, you'll notice that there are very similar outcomes. Again, we're starting to think about interpreting your knowledge, what you've collected so far in your academic history. The second area that we'll be looking at is we're going to practice some communication methods, ways of communicating your research ideas and evidence-based practice ideas. So for example, we'll be using an innovative way to communicate to your classmates about the work that you do over the semester. The fourth learning outcome in the junior level, practice your skills in information and healthcare technologies. By the end of the semester, you should be very confident in being able to use databases and to look for evidence to support your nursing practice. And the last one, again, is you will be applying some ethical and moral frameworks to how you're making your decisions in creating evidence-based practice. So as you think about the course specifically, our first learning outcome for the course is that you'll demonstrate a knowledge of the connection between nursing research and evidence-based practice. So how you'll be demonstrating that is through your work on quizzes, examinations, and some homework assignments. And this is an example of the Cornell method for note-taking, which we will be completing in the first week of the course. This is a great way for us to really synthesize and analyze different articles and readings that we do over the semester. So this is one way that you'll show that you understand the differences between research and evidence-based practice. The next learning outcome is the methods of research. As we think about collecting and analyzing evidence to support our practice, it's important that you have good context as to what types of methods are being used in evidence development and collection. So we'll be talking about areas such as quantitative versus qualitative research, what you might use as the first level of evidence, second level, and other types of evidence to support your nursing practice. How you're going to demonstrate that is through your participation in reaching benchmarks in quizzes, examinations, and our evidence-based practice project, which we'll be completing over the course of the whole semester. Discussion on different types of research with exam questions to demonstrate that you understand what is a qualitative or quantitative research study is an example of one of the ways that you'll demonstrate your understanding. In our third learning outcome, we're going to talk about evidence-based practice process, and we're going to break this down into multiple assignments. So the first thing that you'll be doing is identifying research problems that you've either encountered personally or you are interested in pursuing. The second thing is we'll examine methods to facilitate the application of that research to our own nursing practice. Third, we'll evaluate research findings for applicability and usefulness in in nursing practice with a variety of populations. And the last outcome that we'll meet is based on our findings, are we able to evaluate nursing intervention outcomes and implications for practice? We'll be doing this in a number of different ways, first through quizzes and exams, but also looking at the full evidence-based practice project, which will take in parts over the course of the semester. So one simple example of how you'll meet this outcome is you'll be developing a PICO formatted question using our evidence-based practice model. The last outcome that we'll have in this course is the ethics of research. We'll be doing some group discussions as far as what is ethical in conducting and applying nursing research, as well as how that influences evidence-based practice. The quizzes and examinations will look at actual principles of ethics in research, and we'll be having some group discussions to discuss what is ethical practice for us as nurses. Our guiding principle will be the ANA Code of Ethics, as well as we'll have some examples of how institutional review boards, for example, maintain confidentiality and protect human subjects. So that's it for today. If you have any questions about the learning outcomes, don't hesitate to email me or call me. Again, it's Val Sada, and my email address is sadav@husson.edu. Thank you.